In healthcare, there is a lack of attention in incorporating culture context into the chatbot design, especially for marginalized groups. So we wanted to understand how chatbots can be better designed for the Black community through culture understanding. We conducted interviews and design studies with 18 Black patients with chronic conditions. They had specific roles of the chatbot in mind, such as being a mediator in accessing health services or being a trustworthy voice of the community. We also outlined key features and their challenges. Please take a look at our paper if you'd like to know more.